Hello students, am I audible to you? Yes, I think audible. Yes, okay. So last class, what we studied, little we'll do the revision of that. And many of you said, sir, it is a bit fast. So don't worry about that. Okay, quick revision of last class, and then we'll continue for the next portion. Our today's portion is adrenal gland pending, last class pending part, adrenal gland, pancreatic gland, and then we'll go for the human reproduction, reproductive system, the introduction, and then next we'll go for the introduction of your next class. Actually, one class missing here. So next class, introduction only. That will take hardly 5 minutes. Human health and disease. Okay, so I think we can start. Good evening everyone. Start. Chalo. So last class we discussed about nervous system and endocrine system. Nervous system and endocrine system together called the neuroendocrine system, and neuroendocrine system is also called integrative system. This integrative system, okay, it is responsible for many things in our body, mainly control, command, regulation, and coordination. Okay, then next we discuss about the classification of nervous system. Classification of nervous system, first it is based on, here you have to focus on the basis of anatomy. Anatomy meaning we discussed last class the CNS, PNS classification. CNS mainly brain and spinal cord, PNS afferent and efferent. Afferent and efferent, what is the difference? Afferent incoming, efferent outgoing. Afferent organ to CNS means from our body organ to CNS, brain and spinal cord. What impulses it is carried? It is called afferent system or afferent fiber or sensory fiber. Then efferent, it is nothing but the from CNS to organ. From CNS means from brain, spinal cord to organ. It is called efferent system. Under efferent, again two types of classifications are there, or two types are there. That is based on your voluntary control and involuntary control. First you go to the voluntary control. What it is under your voluntary? Voluntary means under willing control. It is called SNS. We are revising, quick revision. Okay, SNS, somatic nervous system, and ANS, autonomic nervous system. Under autonomic nervous system, PS, NS, and again SNS. This SNS and this SNS, these two SNS both are different, not same. Okay, so this is sympathetic nervous system, this is somatic nervous system. Somatic nervous system, your voluntary nervous control, and involuntary it is ANS. When we are happy, when we are normal, under the relaxed condition, PSNS it is working. So all of you, when you are attending this lecture, in your body PSNS is active, and when you are in stress condition, short-term stress, when you are in the active alert condition, then SNS starts in your body. Suppose just before exam, just before any show, when you are going to dance on any platform, when you are going to perform anything, at that time sympathetic nervous system it starts in your body, and it provides a type of support to your system, support to your body. I think this basic classification clear to you, all of you. Okay, then these are the nervous tissue classification. I don't think here the detailed classification required. Then we studied about different cells. Now I'll jump directly to the neuron structure. Neuron structure, here you have the neuron. In neuron you'll get the cytone. Cytone is nothing but the cell body, pericardion, soma, all it is the same. This central area contains nucleus, contains these branches. These branches are nothing but the dendron. I think you have studied. Okay, so this is called what? The dendron. Dendron word means a small tree. Just these dendrons, okay, small branches it forms are called dendrite. This neck part of neuron, is called axon hillock, and this long projection is called axon. Axon may be covered, may not be covered. If it is covered, tightly insulated, then it is called myelinated. When it is not insulated, it is called non-myelinated. Myelinated, non-myelinated. Then here you can see these cells, green and yellow part. It is Schwann cell. Okay, Schwann cell already we discussed. Then you go to this part, telodendria. Then apolar, unipolar, bipolar, pseudo-unipolar and multipolar neurons we studied. Then I'll go to today's course, last class, the brain and spinal cord position we discussed. Then brain layers we discussed, very important. Brain coverings 3 we discussed. 3 brain coverings are outer one dura mater, then middle one arachnoid, then the innermost one pia mater. Okay, so outermost dura mater, here you can see. Just 1 minute. This one is dura mater, then arachnoid, outer to inner lining it is. Just 1 minute. It's not responding, just a second. Arachnoid and pia mater. Dura mater, arachnoid and pia mater. Dura mater, arachnoid and pia mater. Your wish, Sandeep, you are asking, sir, should we note it down? Your wish. If you want to note it down, your wish. Last class also I said when you want to access all these files, yes, it is available on YouTube. Okay, anytime, any way you can use it. Okay, so point is not to note it down, point is to learn it. Try to ask genuine questions related to this. PDF, if possible, I'll share. Okay. Hatmika, yes, if possible, PDF I'll share. Okay, I'll try to save, but I can't take guarantee of that. Sorry. Come to this next part. We discuss about this smooth brain and this rough brain. Smooth brain means no sulci and gyri, no up and down. Smooth brain means the low surface area, and the rough brain, up and downs more, means more surface area. More surface area means the more and more neurons. More and more neurons means more and more advanced brain, more and more primitive brain in working. Then you move to the next part, hormone. Directly I'll go to the hormone. We studied in endocrinology part. First of all, what is hormone? Simple line, simple language I'll use here. Very simple statement for defining hormone. Hormones are type of messengers, chemical messengers. Okay, one cell it used to release hormone, and hormones they act on another cell, and in this way they help in communication. So exactly here we are discussing in zoology how our body cells they communicate to each other. Communication language we are studying, body language, not this body language that how my body used to show signs and symbols to express my feelings. No, how my cell it used to communicate to another cell, how my brain it used to communicate to another organ. That is called the chemical language, endocrinology. In chemical language endocrinology, first we studied about all the glands, main glands, all the main glands. Yes, so many glands are there. Main glands are pituitary, pineal, thyroid, adrenal, pancreas, parathyroid, thymus and gonad. You can neglect this one. In main class we'll discuss this one. In main class, leave it. Then we studied about Then we studied about the hypothalamus, and pituitary. Hypothalamus and pituitary. Hypothalamus, this area is hypothalamus, lower part of brain. This is pituitary. Pituitary anterior part is anterior pituitary. Pituitary back part is posterior pituitary. Anterior part it releases 5 types of hormone. Posterior part releases two mainly types of hormones, two types of hormones. So here 5 types of hormone, 5 group of hormones. This one 5 group of hormones, and this one 2 group of hormones, anterior pituitary, posterior pituitary, anterior pituitary, posterior pituitary. Is this clear? Yes, very good. Nice response. Very good, very good. Okay. Now you go to the next part. There is lag. Just give me 1 minute to solve this. Okay, so anterior pituitary, posterior pituitary, total pituitary, it is situated in one bone. Bone is called sphenoid bone. Important. Yes, this is important. Sphenoid bone. Sphenoid bone. Here is sphenoid bone, everyone. Okay, it forms one cavity. That cavity is called sella turcica. Cavity is called here sella turcica. Then posterior pituitary, 2 hormones. I'm starting from posterior pituitary, the ADH and oxytocin. ADH is also called vasopressin. Okay, then anterior pituitary, 5 group of hormones, ACTH, follicular stimulating hormone and luteinizing hormone. This is together called gonadotrophins. No need to mug up, just FSH and LH you need to remember. Growth hormone, you know. Prolactin, milk synthesizing hormone. Prolactin, milk synthesizing hormone. Thyroid stimulating hormone. Okay, and you'll be confused, sir. Thyroid stimulating hormone and thyroid hormone, both are different. Thyroid stimulating hormone from your pituitary gland, it works on thyroid gland. Thyroid stimulating hormone from pituitary on your thyroid gland, and thyroid gland releases thyroid hormone. Thyroid stimulating hormone, then thyroid gland releases thyroid hormone. T3, T4. Thyroid hormone is called T3 and T4. Leave it. Summary done. Then this is summary of the all pituitary hormones. Okay, MSH and pars intermedia part you need to neglect now. Okay, this is summary again. Okay, you neglect this part, mainly this part. Yes, it is your notes. This part is your notes. Just keep it your window, your YouTube window in resting condition, and take one screenshot. This is your notes. Okay, so later you can take the notes. Yes, Alex, if you have any doubt, yes, you can ask. Alex, yes, your doubts. Quick. Alex, your doubt, I'm waiting. Chalo. Growth hormone. Growth hormone from your pituitary, it works on whole body. Pituitary hormone on whole body. When it acts on whole body, your body height increases. But growth hormone, when it is secreted normally, okay, yes, I'll say slow. Okay, yes, I'm teaching slowly. It is revision. It is revision. So when growth hormone, it is released normally, it is responsible for physical growth. What is physical growth? Your skeletal growth, your muscular growth, your visceral growth. Skeletal and muscular you can understand. What is visceral growth? What is visceral growth? Visceral growth is nothing but the internal organ growth. Internal organ means intestine, large intestine, your stomach, heart, lungs, etc., etc. Okay? Chal. Then visceral means internal. And skeletal and muscular, it is responsible for your height increase. Suppose growth hormone, it is released. Suppose growth hormone, it is released low in concentration, hyposecretion, low in concentration condition is called hyposecretion. Condition to lead to ateliosis or dwarfism. First part, yes, you need to summarize, you need to understand this one. Dwarfism, stunted, S-T-U-N-T-E-D, S-T-U-N-T-E-D, stunted growth, or also called dwarfism, or also called ateliosis. Then go to the gigantism, hypersecretion, more secretion. Hypersecretion means more secretion of growth hormone during childhood. It leads to gigantism. You can see here the gigantism. Gigantism is more growth, abnormal growth. This is gigantism. Okay, then go to acromegaly. Acromegaly is also hypersecretion, but during adulthood, not childhood. Okay, this is also summarized. Then go to thyroid gland. Thyroid gland we discussed, it releases thyroid hormone responsible for BMR regulation. Okay, if thyroid hormone release less, more, then things. Now, fresh topic, the adrenal gland. Adrenal gland, where it is present? It is present on top of your both the kidneys. Okay, anterior or superior to both the kidneys. Here the first point, adrenal gland is a samosa like gland, pyramid like gland, samosa like gland, pyramid like gland, and it is having two areas. It is having two areas. Outer area is called cortex, inner area is called medulla. Outer area cortex, 80% of total gland. Inner area medulla, it is 20% of total gland. It is mesodermal in origin. Very simple. Mesodermal. What is mesodermal? If you don't know, okay, just mug up now. I'll explain in detail later on. Ectomesodermal. Total gland is ectomesodermal. How I'm saying ectomesodermal? Ecto plus meso. Ectomesodermal. Ectomeso. Outer layer. This is outer layer. Samosa gland. Okay, don't write in exam samosa gland, but I'm saying it's samosa gland just for your easy understanding. Okay, here it is, the inner one is medulla, outer one is cortex. Okay, leave it here. This gland is also known as, leave it here only, don't read more. Okay, just jump to this part. This gland is also called forest gland. Why it's called forest gland? Four things in your body it is controlled by this adrenal gland: salt retention or salt metabolism, sugar metabolism, sex hormone means testosterone, estrogen. It is the little control, not much, little control by this gland, and stress reaction. Two types of stress it is there: the long-term stress, short-term stress. When you're writing your board exam, class 10th board exam, you all are under long-term stress, months of stress, 10 days, 20 days of stress. That is the long-term stress. Suppose for 10 minutes, for half an hour you are in stress, that is short-term stress. So for long-term stress, short-term stress, what hormone is responsible? I'll say. Okay, so this gland is called 4S gland. Everyone, this is clear. This gland is called 4S gland. Why 4S gland? S, salt retention, sugar metabolism, sex hormone, and stress reaction. I think clear. Very good. Then go to the where it is present on top of kidney. This yellow part is adrenal gland. The adrenal cortex area. To whom I'm saying the cortex? What area is called cortex? This outer area is called cortex. Everyone visible? This outer area is called cortex. And cortex contains 3 layers. Cortex contains 3 layers: zona glomerulosa, zona fasciculata, zona reticularis. Okay, so zona glomerulosa, fasciculata, and reticularis. Here you can read, you can understand zona glomerulosa, zona fasciculata, zona reticularis. Okay, directly go to summary of this. Here, zona glomerulosa releases mineralocorticoid, mineral balancing hormones. Okay, your attention required, everyone. If little you are attentive towards topic, everything super simple. If you are attentive. If you are not attentive, sorry, I can't help. Okay, I said zona glomerulosa. Zona means zone, area. Zona means zone, area. Zone. So zone number 1, zone number 2, zone number 3. And it is medulla. This part is medulla. Medulla is having different hormone. So I'm not explaining medulla for this instance. next line only medulla it will come. Mineralocorticoid by glomerulosa, first layer. You can't understand glomerulosa, directly say first layer. Okay, second layer, glucocorticoid. So mineralocorticoid, salt retention, salt maintenance. Okay, yes, very good. Then go to the glucocorticoids. Glucocorticoids, everyone. Glucose maintenance hormone are called glucocorticoids. Then sex hormones. Sex hormones means low concentration of testosterone and estrogen. Remember, sex hormones are mainly released from gonads, ovary and testes, not from adrenal gland. Adrenal gland releases sex hormones in very low concentration, small concentration. That's why I'm writing here the sex hormones. Clear or not? Everyone, I think this is clear. Sex hormone part clear, everyone. Then go to the medulla. Medulla releases adrenaline and noradrenaline. Adrenaline and noradrenaline. Both are having same action. Adrenaline and noradrenaline, both the hormones are having same action. Remember this stuff. Same action means, okay, both they are having the similar type of action, two different words. Both these are brothers. You can say both these are brothers. So what they are responsible for? Short-term stress. This is tough. When you are in short-term stress, okay, this type of things, it is with you. Fear, fight, fright syndrome. And sympathetic nervous system, what we studied in nervous system, it comes. Sympathetic nervous system. Everyone clear? Okay, good. Go to next. Here the long-term stress and short-term stress classification. Short-term stress, when you are under 10 minutes, 20 minutes of stress, exam fear, in exam hall, or suppose you did anything wrong and your parents, they are scolding you, at that time short-term stress. Which hormone is responsible in short-term stress? Which hormone is responsible for short-term stress? Epinephrine, norepinephrine, or adrenaline, noradrenaline. Okay, both are same. Epinephrine and norepinephrine. And for long-term stress, glucocorticoids, and little amount of, arrow down, little amount of mineralocorticoids. Okay, you can omit it. You can leave it. You remember only glucocorticoids. Remember only glucocorticoids. This is done. Okay, pancreas. Pancreas, the three types of hormones are there from pancreas. Pancreas is a mixed gland. It is having endocrine part as well as exocrine part. Okay, so please focus here. Endocrine part as well as exocrine part. Exocrine part is 98 to 99%. Means pancreas gives pancreatic juice for your digestion. Your digestion in your intestine, it is by pancreas. Pancreatic juice. 1 to 2% of pancreas, where it is present? Duodenum. You have the small intestine, first part, duodenum, and in that groove it is present. Thin membranous gland. It is the pancreas. It opens into duodenum. Leave it. The endocrine part, 1 to 2% of pancreas. 1 to 2% of pancreas. It contains islets of Langerhans. And islets of Langerhans are made up of 1 to 2 million islets. Total Langerhans it is made up of 1 to 2 million islets. 1 to 2 million islets, they contain mainly three types of cells. Mainly these three types of cells. Okay, you can neglect this fourth one: alpha cell, beta cell, gamma delta cell, or sigma cell, you can say. Okay, delta cell, you can say. Alpha cell, beta cell, name is very clear. This third one is gamma or delta cell. You can say gamma, you can say delta. Sign I'm using, that symbol I'm using only one, but you can say delta cell or gamma cell. Yes, it is mixed gland. Yes, Ajay Varma, yes, it is mixed gland. Very good. Then go to PP cells. PP cells are very few, so neglected. This is 25% and releases. This is most important, everyone, most important. Glucagon. First hormone here, you studied here in pancreas, glucagon. Glucagon increases your blood glucose. What it increases? Glucagon increases blood glucose. It increases blood glucose. Very good. Then next, beta cells, They are 65% maximum, and it releases insulin. Very well known hormone to you people. You may have heard about diabetes. Today we are going to discuss about a little about diabetes. So 65% of the cells are beta cells. They release insulin. Okay, and diabetes, you know, no insulin, so the diabetes disease. Insulin is there but not working in your body, then also diabetes. Two types of diabetes we'll discuss. So insulin, it decreases blood glucose. Suppose you lack insulin in your body, insulin is either less or not working. I'm saying either less or not working. In both case, your blood glucose, it will not go down, it will be high. And that condition is called diabetes mellitus. Not diabetes, diabetes mellitus. Diabetes means flow. The word diabetes means flow. And mellitus means sweet. So those who are diabetes patient, insipidus we'll discuss. Insipidus disease is related to the ADH hormone. Leave it. Go to diabetes mellitus. Diabetes mellitus, okay, it is sweet urine disease. Remember this line, sweet urine disease means in urine, okay, there'll be sugar loss, glucose loss, okay, and that condition is called glycosuria. Glyco means glucose, suria, it will come, that word will come here. Glycosuria means loss of glucose in urine. So alpha cell glucagon increases glucose. Alpha cell glucagon hormone, and it increases your glucose. Beta cell, it decreases your glucose. And delta cell or gamma cell, it maintains, it secretes somatostatin hormone. Somatostatin maintains both of these, or it controls insulin and glucagon. It controls both insulin and glucagon. I think this is clear. Mainly you have to focus in these two hormones, these two cells. Mainly somatostatin you can neglect. Mainly for the quick and better understanding, please focus on these two hormones. Yes, this is basic stuff. Janvi Reddy, this is basic stuff. This is very much basics. This is very much basic stuff. Okay. Chalo, next. So these two words, can you remember? Glucagon, insulin. Yes. Chalo, next. So next is okay, insulin. Insulin increases uptake of glucose, or simply increases your cellular glucose, decreases blood glucose. Decreases blood glucose. Here, what you want answer or notes, everything for you here. It lowers blood glucose. It increases glucose in your cell. It increases glucose in your cell. So cell glucose increases, blood glucose decreases. If insulin is absent in your body, low secretion or not working, both possible. Whether it is not secreted, not available in your body, symptom it will be same, problem it will be same, that your blood glucose it will be high. Any of your grandparents or parents, if they are suffering through, okay, if they are suffering through suppose diabetes, okay, so their blood glucose is high, glucose uncontrolled, yes, diabetes mellitus. Okay, so raised blood glucose level. Secretion control is made by when insulin is secreted, when there is high blood glucose. When high blood glucose, insulin is secreted. When there is low blood glucose, evening you have taken your snacks. So when you have taken your snacks, glucagon it is working now in your body. Okay, and by 9 o'clock, suppose you're waiting for your dinner, at that time insulin it will work. When you have taken your dinner, insulin it will work. Okay, so it used to balance your blood glucose. Glucagon and insulin used to balance your blood glucose. Okay, somatostatin you can neglect. It maintains mild inhibition of insulin and glucagon. Leave it. Go to next directly. Okay, diabetes mellitus. What is diabetes? Diabetes, 5 minutes discussion required here, everyone. Okay, what is diabetes? Diabetes, two words here. Diabetes mellitus. Diabetes means flow, I'm saying. Mellitus means sweet. In urine, if there is sugar loss, so it is called diabetes mellitus. When it is possible, our normal blood glucose is, everyone, your attention required, our normal blood glucose is 80 to 120 mg per deciliter. Normal blood glucose. Mug up this one. Yes, buttify this one. Okay, normal blood glucose 80 to 120 mg per deciliter. Deciliter means 100 ml. Deciliter means 100 ml. Then go to prolonged hyperglycemia. We are discussing diabetes. So those who are diabetic patients, they'll suffer through prolonged, long duration of hyperglycemia, more glucose in their body. This more glucose means more than 180 mg per deciliter. Condition is called diabetes mellitus. Diabetes mellitus. And when they're suffering through diabetes mellitus, loss of glucose through their urine. Urine, it will be lost through their, glucose, it will be lost through their urine. Condition is called glycosuria. This condition is called glycosuria. Glucose in urine, glycosuria. Okay. Then these are also problem related to diabetes. Polyuria. Diabetes patients, they are going to micturate or they are going to urinate more. Diabetes patients, they are going to make more urine. Very much clear, it's written here. Polyuria, excessive urination. Polydipsia, they'll feel more thirstiness, more eager to drink water. That is excessive thirstiness. Polyphagia. Polyphagia means excessive hunger. Excessive hunger means always they'll feel that yes, I'm having low glucose, but exactly in blood, in body, high glucose is there. But body cells, they're not getting glucose. That's why polyphagia. They'll feel hunger always and always. Means even they have taken a meal, they have taken food, then also they'll feel that they are hungry. Okay. So sometimes they'll feel they'll face dehydration, water loss, and weight loss, loss of weight, body weight, ketonuria. Ketonuria you neglect. Abnormal metabolism and tiredness. Okay, they'll be tired. Ketonuria is ketone in urine. In main class, we'll discuss what is ketonuria. To explain ketonuria, long duration, long time it is required. Okay, so leave that ketonuria. Mainly you focus on dehydration, loss of weight. Yes, diabetes patient, they lose weight. Okay, and abnormal metabolism and tiredness. Very simple. Okay, so diabetes patients, what they take? They take either medicine, tablets, or insulin injection. Yes or no? Okay, now we are going to discuss about the next part, human reproduction. So first question, what do you mean by reproduction? Can you answer? What do you mean by reproduction? So what do you mean by reproduction? Yes, insulin injection, after insulin injection, yes, the sugar level, it will decrease. Okay, yes, your question is correct. Insulin injection, if anyone will take, yes, sugar level, it will decrease. But insulin injection must be taken under doctor's advice, not that you go to clinic, you go to any medicine shop, purchase insulin injection and take it. Okay, so it may be overdose or it may be low dose and will not work. Only diabetes patient, they must take insulin injection, not normal people. Okay, so here you come to reproduction. What do you mean by reproduction? First question. Anyone? What do you mean by reproduction? Correct answer to the process of the mechanism of the biological system where species, they form similar organisms, similar species. It is called reproduction. Reproduction may be sexual, may be asexual. What do you mean by sexual? What do you mean by asexual? Okay, definition of reproduction clear. Definition of reproduction is production of similar species okay, from one organism, it is called reproduction. Okay, here participation of two individual in reproduction, it leads to sexual reproduction, and in case single individual is involved, it is called asexual reproduction. When two individuals are involved, it is called, okay, diabetes we can discuss again. Okay, sir, if low diabetes is there, which medicine is taken? Low diabetes, there is no condition to low diabetes. There is condition low sugar. Okay, so low sugar means to take food. If you have the low glucose, low sugar, then take food, not medicine. Okay, please focus here. Okay, our next point is the definition clear. Sexual, two individuals involved in sexual reproduction. Two individuals. In two individuals, one it will be male, one it will be female. Very simple. Okay, and male and female concept means two individuals have one will form one gamete, another it will form another type of gamete, and among them, one it will be large gamete, one it will be small gamete, and we call it yes, parents. One parent is enough in asexual reproduction. Yes, correct. Not enough, it is asexual, not enough or sufficient, it is called asexual. Okay, generally in one critical question, everyone, your attention required. Okay, listen to this question and answer. Listen to this question and answer. I'm asking one simple and critical question. Question is, in first one statement, in sexual reproduction, gamete formation occurs. I'm saying to have the gamete formed. Gamete formed. Gametes are formed. Male gamete, female gamete, ova, sperm formed. In asexual reproduction, gametes are formed or not? I'm asking, gametes are formed in asexual reproduction or not? Answer, it is coming to maximum that yes sir, no sir. No is maximum answer. Yes also in some of you. Okay. So those who are yes, they are right. Those who are yes, they are correct. In asexual reproduction also gamete formation is there. One example, only one example is there called parthenogenesis. I think you have heard about parthenogenesis, honeybee. Okay, so I'm explaining asexual reproduction. One example, parthenogenesis. Parthenogenesis. Okay, so what is parthenogenesis? Simple, just listen. Okay, generally in asexual reproduction, no gamete formation. General point I'm saying. Generally no gametes. Okay, one exception is parthenogenesis. What is parthenogenesis? Those who are listening first time, parthenogenesis. Okay, yes, very good. Formation of embryo without fertilization. Very much correct. Yes, parthenogenesis. Okay, queen honeybee. This is the queen honeybee. Queen honeybee used to lay eggs. Okay, these are eggs. If eggs are fertilized with sperm, so here to white these arrows after sperm, suppose. If fertilized with sperm, it will form female. If suppose not fertilized, then it will form male. So here male form. Male is what here the result of parthenogenesis. Here only female gamete required. Means gamete required. Gamete involved. But there is no. Listen everyone. Here gamete involved. Okay. Queen butterfly used to lay egg and not fertilized, and unfertilized eggs are converted into male. Fertilized eggs are converted into female. I think meaning clear. So here males are parthenogenetically formed without fertilization form. So single mother involved or single parent involved. So it is asexual reproduction, but not asexual reproduction, but here okay, gamete involved. You can't say that gamete not involved. Gamete involved. Yes, it is an example. Very good. Next. So now next we are going to discuss about the human male reproductive system. Human male reproductive system. In human male reproductive system, if I'll ask the primary question, simple question, that what is primary reproductive organ? What is secondary reproductive organ? What is accessory reproductive organ? Can you answer, please, fast? Male reproductive organ. Hello, everyone. Please try to answer. Male reproductive organ, primary, secondary. Very good. Primary, testes. So why we call testes as primary reproductive organ? Answer is primary reproductive organs are those organs which are responsible for gamete formation. Gamete formation, just. Gamete formation organs are primary reproductive organs. Gamete forming organs are primary reproductive organ. Secondary reproductive organ, gamete transport. Gamete transport. Any organ responsible for gamete transport, okay, is called secondary reproductive organ. In human male, testes, it is singular, and I'm writing TES. Then it is plural, okay, and it is what the primary reproductive organ. Okay, secondary reproductive organ, gamete transport. So rated testes. If you want all these references, you can refer to NCERT books. Rated testes, okay. Then vas deferens, okay. Then epididymis, okay. This is secondary reproductive organ. Secondary reproductive organ. No, seminal vesicle, no. Seminal vesicle is not used for transport. Seminal vesicle, those who are answering, it is accessory reproductive organ. Okay. So what is helping in reproduction is called accessory reproductive organ. Helping. Secondary transport. Okay. Primary gamete formation. Secondary transport. Accessory helping. So those organs in body helping in the gamete transport or anything, okay, is called accessory here. Accessory means helping. So answer is the seminal vesicle. Those who don't know these names, don't worry. It is all mentioned in book. And if you are learning first time, just relax. Seminal vesicles. Okay, prostate gland. Bulbourethral gland. Bulbourethral gland. Note it down, or you can take the screenshot. Everyone clear? Ejaculatory duct is vas deferens only. What about ejaculatory duct? One question. Datta, Jayant, and ejaculatory duct is vas deferens. Ejaculatory duct is part of vas deferens. Okay, so that I'll explain in detail when you'll come here. Don't worry about that. You focus here back. Okay, so here you can see the lateral view of male reproductive system. Here you can see the ventral view of male reproductive system. Okay, so testes, this part is testes. Testes present in scrotal sac, one skin chamber, and that testes, it forms sperm, male gamete. Male gametes, they travel in this direction, and to this area. This area is ejaculatory duct. If you're asking, sir, what about ejaculatory duct? So here you can see ejaculatory duct. Okay, so this is what? Vas deferens, and vas deferens only forming ejaculatory duct. This pink one is seminal vesicle. This area is the prostate gland. This is prostate gland. And here is bulbourethral gland. Bulbourethral gland not labeled here, I think. So don't worry, we'll discuss in another diagram. Okay, so basic lateral view clear. One mind setup that how these ducts are connected. Simple one, clear. Now you go to this one. Here it is internal section of testes. Testes contains internal chambers. Testes contains these internal chambers. In these internal chambers, the sperm it is formed. Sperm it is the synthesized. Sperm then it is transported to retetestes. This area is called retetestes, and retetestes to epididymis. This area is called epididymis. Okay, so when you are revising, you can see these videos again and again, and you can check that what area I'm explaining as epididymis, what area I'm saying as the vas deferens. So this is vas deferens. Okay, this is epididymis, and these are testicular compartments or testicular chambers, locules. And in testicular locules, the thread-like structures are there, and these thread-like structures are called seminiferous tubule. You can repeat, seminiferous tubule. Note, NCERT books you have to purchase by your own. Okay, college never provides NCERT books to students. We provide our study material. Our study material, it contains everything, but your Gita, Bible, Quran, everything for your NEET selection is NCERT book. Everything for your selection is everything. For biology, it is the NCERT book. Okay, great. Ramesh in comment box. He is my old student. Okay, and he is in KMC Kanol. Thank you, beta. Thank you for your words here. Okay, please again back to this. So basic things I'll say here only. Back to this diagram. Here it is external view of the testes. This is cut section of testes. Testes you cut, internally you'll get these chambers. Leave it. Here it is after scrotum. Remove scrotal skin, you'll get testes, epididymis, vas deferens. So now that concept that how it is arranged, that is clear. Testes plus, one more thing you can write in your notebook. Testes plus epididymis is called testicle. Testes plus epididymis is called testicle. If you have purchased old NCERT, no problem. New NCERT you can download. Okay, one of the student he or she purchased old NCERT, no problem. Keep it old NCERT with you. New NCERT PDF it will be available on the website of NCERT, and from there you can download. Okay, leave it. Chalo, go to this. Here same testes, compartments very much clear here. You can see these are testicular compartments. Okay, and these are seminiferous tubule, and this is epididymis. Very much a clear diagram. Okay, then here again testes, epididymis, vas deferens, and then here the seminal vesicle, ejaculatory duct, prostate gland, and then external genitalia, male penis. Male penis, it comes out or it carries urethra. Urethra is common for, remember, this passage is common for, urethra is common for urine as well as semen. So those who don't understand what is semen, I'll explain, wait. So urethra is the common for urine as well as semen. So our next point is semen. What is semen? Semen is sperm plus all male reproductive gland secretions. Sperm plus all male reproductive gland secretions. It is called semen. So we are going to discuss next is semen. So what is semen? Semen is sperm plus accessory reproductive gland fluid. What is accessory reproductive gland fluid? Nothing but the seminal vesicle plus prostate gland plus bulbourethral gland. Okay, these three gland secretion. I'm writing in shortcut in NCERT. Clearly all these words are mentioned. Leave it. Semen, clear. How much semen one healthy male ejaculates in one ejaculation, one coitus? Okay, it is volume is 3 to 4 ml per ejaculation per coitus. Okay, pH of semen slightly alkaline, 7.3. For normal fertility, if that male is fertile, going to make means fertilize egg. What is normal fertility sperm count required? Is 20 to 120 million per ml. 20 to 120 million per ml. This is normal sperm count. Okay, then sometimes it is the low sperm count. Then the males, they are not fertile, means that they can't make babies, or they are not going to be father. Okay, failure in the fertilization of the sperm, ova. So condition is called infertility. Now infertility conditions I'll explain. Why one male, okay, chances are there that he is going to be infertile. Many possibilities are there, many types. Few we can discuss related to sperm. Chalo, oligospermia. Sperm count low. Sperm count low means here any question? Okay, so sperm count less than 20 million. So minimum is 20, maximum 120 per ml. If it is less than 20 million, then condition is called oligospermia. Oligo word means few. The word oligo means few. Ozoospermia. Suppose in a male no sperm count, either absent or near to absent sperm. Condition is called ozoospermia. O means absence. Then go to asthenospermia or asthenozoospermia. Two words you can use, asthenospermia or asthenozoospermia. Reduced motility means sperms are there, but they are not swimming. They are immotile. Sperms are healthy, okay, but not motile. They are not swimming. They are silent. They are not swimming. So reduced motility of sperm in semen. It is called asthenozoospermia or asthenospermia. This one also it will lead to infertility. Then go to teratospermia. Sperms are not of normal morphology. Normal morphology of sperm is what? This one. Here you can see the normal sperm. See this one. Normal sperm is this. Sorry, not in this slide. So I'll draw one small sperm diagram. Suppose this is head of sperm. This is the neck of sperm, middle piece of sperm, and tail of sperm. So if suppose abnormal sperm is there, head and two tails are there, suppose. So it can't swim. Don't think that, sir, two tails, it will swim faster, it will reach over more faster. Sorry, no, not possible. Suppose this head is not properly shaped, it is like this. Okay, so it will also fail to fertilize oocyte. Okay, so if abnormal morphology, condition is called teratospermia. Necrospermia, dead sperms in semen. Sperms are there but dead. All these conditions and many more other conditions are also there. Hematospermia, blood in semen, and list is very long. So few you can understand and remember. All these will lead to infertility. Now female reproductive system. Female reproductive system, okay, it consists of same primary reproductive organ, secondary reproductive organ, and accessory reproductive organ. So can you answer what is primary reproductive organ for the female? Definition it will be same what we studied in male. Very good, very good. Fast answer. Ovary, ovaries. Next, secondary reproductive organ. Secondary reproductive organ means what it carries gamete. It carries gamete is the fallopian tube. And you can see oviduct. I'm writing here the uterus. Uterus also that comes under secondary reproductive organ because the uterus is modified fallopian tube. Uterus is oviduct means okay, what it carries ova is called oviduct. Fallopian tube is also oviduct. Fallopian tube is modified oviduct. Fallopian tube, uterus, it is secondary reproductive organ. Accessory reproductive organ, I'll write here the mammary gland. Mammary gland is not responsible for the gamete transport, okay, but it is responsible for the nourishment of baby. Means reproduction not possible if babies are not nourished after birth also. Okay, we need to take care of babies, and that is only possible by nourishment from mother side. Mammary glands, clear or not? Okay, so mammary gland is accessory reproductive organ. Accessory reproductive organ. Very good. Now I'm going to explain the anatomy of these organs. Anatomy you can refer here. Here you can see the ovary, fallopian tube. Here the labelings are very much critical, or you can say advanced. You can use this diagram also, the simple one. Here you can see the ovary. How many ovaries? Or how many ovary? Two ovaries. So ovaries. So here one, here it is the, you can say compact, complete ovary. Here it is the, okay, cut section of ovary. You can see internal to ovary follicles are developing. Yes, new word I've given to you. The follicles are developing. Follicles are nothing. Follicles are cluster of cell. In that cluster of cell, female gamete oocyte is growing or developing. Female gamete oocyte, just like spermatocyte, sperm. In female oocyte, it is growing. In every menstrual cycle, listen everyone, in every menstrual cycle, okay, ovulated egg, it comes out from ovary. Ovulated female gamete, it comes out from ovary into this space, and from this space it enters into fallopian tube. In fallopian tube, inside fallopian tube, it waits here for fertilization. For fertilization. If sperm available, if sperm is there, then fertilization complete, fertilization done. If sperm available, then fertilization done. If sperm not available, then it is destroyed. Means this secondary, this oocyte also destroyed, and endometrium, this layer of uterus is called endometrium. This layer is called endometrium. Endometrium also shed out from body, and in next menstrual cycle again it is prepared. Means it is, menstrual cycle is cyclic event in female's reproductive cycle or female's reproductive system. Okay, what it allows or permits that body to conceive pregnancy or to receive pregnancy. If menstrual cycle is not going on, or these changes are not going on, means this female is not fertile, or maybe other consequences are there. So I'll summarize here. I'll say that okay, if uterine cycle is going on, means the uterus, it is okay, growing and shedding off. Okay, in ovary follicles are growing. Means egg it is growing, female gamete it is growing, and all it is controlled by the four hormones mainly. FSH, LH, estrogen, progesterone. FSH, LH from pituitary. FSH, LH from pituitary, it works on ovary. FSH, LH, it works on ovary. Which two hormone? FSH and LH works on ovary. And ovary releases two hormones. Estrogen and progesterone. And estrogen and progesterone is main female reproductive hormone. Remaining things next class. So tata, bye bye everyone. So what we studied here, it is that female reproductive anatomy we studied. The next class we are going to discuss again these layers, endometrium, and little bit more about these leveling about cervix, vaginal cavity, vulva, and all this. So all of you have a nice day. Tata, bye bye. And then next class we'll discuss about the gametogenesis also. Okay. So thank you. Have a nice day.